Hi everyone, Dr. Chiam here from Ensoul Medical. Let's talk a little bit about stretch marks. So stretch marks, it happens quite commonly. We don't really talk a lot about it, but there are effective treatments out there for stretch marks that are available to our patients. So the medical term for stretch marks is striae, and these are basically long, narrow streaks that happen in areas such as the abdomen, the breast, the hip and the thigh, and it usually corresponds to a period of a lot of weight gain. So the commonest time that people get stretch marks is of course pregnancy, and sometimes in patients who experience puberty or a lot of weight gain, they do get stretch marks as well. So stretch marks happen because of the breakdown of collagen and elastic fibers during weight gain, and as I mentioned, the commonest cause of stretch marks we see is during pregnancy, and stretch marks that occur during pregnancy is termed as striae gravidarum. These stretch marks typically happen in 55 to up to 90% of ladies who get pregnant, and of course it can range from very mild to very severely disfiguring. In the modern day and age, we do have some good treatments that are available to help these patients, and I will go through these with you in a later stage. So stretch marks during pregnancy or striae gravidarum typically starts off with reddish or purplish marks. These are bands that happen along the abdomen, the breasts or the thighs and the hips, and this purplish stage is usually referred to the immature stage of the stretch marks. Over a period of months to even years, these purplish reddish marks become lighter in color and become white, and these are the more mature stretch marks, and these stretch marks are typically sometimes itchy and often have a burning sensation to them during the formation. The stretch marks also typically surface during the later part of the second trimester or the early third trimester. So what are the risk factors that predispose patients to stretch marks? Of course, there are many different studies that actually do differ slightly in opinion, but in general, the commonest associations with development of stretch marks during pregnancy include patients with the first pregnancy, patients who are younger when they are pregnant, or patients with a family history of stretch marks, and lastly, patients with a higher pre-pregnancy weight or a higher pre-delivery weight. So a lot of patients ask us how we can prevent stretch marks from happening in the first place. And of course, there are many therapies, over-the-counter therapies that have been advertised out there, and many patients during pregnancy try various remedies to try to prevent the formation of stretch marks or even reduce the appearance of stretch marks. In general, preventive measures have had very little and very limited success. Remedies that have been proposed include this compound called Centella asiatica. This is a herbal compound. It has shown some success in reducing the severity of stretch mark formation, but it actually doesn't prevent the formation of stretch marks. We do have other remedies such as cocoa butter, olive oil, and almond oil, as well as hyaluronic acid that have been postulated to help with the severity of stretch marks, but these are generally not very validated. And so in general, it might be the case that there's very little we can do to prevent stretch mark formation, but instead most of these remedies may just reduce the severity of stretch marks. So what treatments are there available for patients with stretch marks? Of course, for treatments, we generally divide them into topical treatments, meaning creams and lotions, as well as procedures, meaning maybe lasers and devices that can help with stretch marks. For topical treatments, generally the retinoids have been shown to help with reducing the severity of stretch marks. So retinoid formulations such as tretinoin, either 0.05% or up to 0.1%. It has been shown to help increase the production of collagen and elastin fibers within the stretch marks itself. There are also other formulations such as glycolic acid. Typically you need about 20% glycolic acid in combination with ascorbic acid, which is vitamin C, which have been shown to help the appearance of stretch marks. So these formulations have had success in reducing the length as well as the width of the stretch marks. But of course, these formulations also need to be prescribed by a doctor, and they tend to cause a fair bit of skin irritation and redness, so they have to be used with care. So what procedures are there out there to help patients with stretch marks? So in our clinic, we use a combination of lasers as well as radiofrequency devices to treat stretch marks. So for lasers, there are the fractional lasers as well as the non-ablative lasers. Fractional lasers such as the fractional erbium laser or fractional CO2 laser help by stimulating the production of collagen in the stretch marks as well as elastic fibers. In general, I personally prefer to use the erbium laser over the carbon dioxide laser because the erbium laser produces less downtime, and also it has a lower risk of post-inflammatory hyperpigmentation compared to the CO2 lasers. The improvements vary from 50% to 75% over a period of about 6 treatments or so. These treatments do come with a little bit of downtime, so patients should expect to have a little bit of redness and swelling over the area, together with some flaking over the next few days. There are also non-ablative lasers that could help with stretch marks, especially when the stretch marks are still in the immature phase or during the red or purple phase. So we do use yellow lasers or long pulse ND lasers to help to reduce the appearance of the red and purplish stretch marks, because these generally work on the blood vessels and it also helps to reduce the itch associated with stretch marks. So there are also other devices such as the radiofrequency devices that are emerging as treatments for stretch marks. We basically approach treatment of stretch marks like we approach scarring. So the basis of the basis of using these radiofrequency devices is to firstly remodel the collagen fibers in the area, as well as stimulate more collagen and elastin formation in the affected area. So we have two main modalities of radiofrequency devices. We have the ablative radiofrequency devices in our clinic, known as the Puro treatment. This is an ablative radiofrequency which is applied on the surface of the stretch mark, and it helps to stimulate collagen and elastic fiber production by running electric current through the affected area. The second radiofrequency treatment, is radiofrequency microneedling. So this involves small little needles that go into the affected skin and emitting radiofrequency energy or electric current through insulated needles. This has an added advantage of actually introducing small little areas of controlled injury with the needles, in addition to the radiofrequency stimulation to produce more collagen and elastic fibers in the affected areas. So the radiofrequency devices are the preferred treatments for stretch marks in our clinic. So these treatments are generally quite comfortable. You probably only need a little bit of numbing cream over the area and generally produce very little downtime, maybe of about 2 to 3 days. So we've covered a little bit about stretch marks, why stretch marks come about and what can be done to prevent them, and what treatments there are in the market. In general, we've spoken a lot about stretch marks due to pregnancy, but the treatment options that we have presented also apply to stretch marks that occur because of other reasons such as weight gain or puberty. So if you find that you have any stretch mark problems, do drop into the clinic for a chat, and we'll be more than happy to come up with a treatment plan for you.